A shift in vaccine advisory, understanding the new members of RFK Jr.'s panel. In a bold move that has stirred significant discussion, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has appointed 5 new members to a crucial vaccine advisory panel, a group he previously restructured in June. This decision comes just ahead of an important meeting of the Advisory Committee on Immunization Practices, ACIP, set to take place on Thursday and Friday. During this session, the committee will evaluate data and provide recommendations regarding vaccines for COVID-19, hepatitis B, and the combined measles, mumps, rubella, and varicella vaccine, all in preparation for the upcoming fall and winter seasons. So, who are these new advisors and what do they bring to the table? Among them is an infectious disease specialist known for opposing COVID mandates, including vaccine requirements, and another member who has promoted unverified treatments for the virus, such as ivermectin. Neil Maniar, a public health professor at Northeastern University, expressed concern about the qualifications of some of the new appointees, stating, "There is evidence suggesting that certain members may have formed their opinions based on dubious scientific data or have misinterpreted scientific findings. This skepticism is not unfounded, as the previous 7 members appointed by Kennedy were recognized figures in the vaccine skepticism movement." Kennedy argues that dismantling the previous committee was essential to rebuild public confidence in vaccinations. Traditionally, ACIP has comprised independent medical and public health professionals who base their recommendations on the highest standards of scientific evidence. Maniar highlighted the troubling shift in direction, noting it is concerning that we are veering away from a committee that plays a vital role in shaping immunization policy and coverage in the United States. The ACIP routinely assesses vaccine data and advises the Centers for Disease Control and Prevention, CDC, on who should receive vaccinations and whether insurance companies should cover these shots, among other responsibilities. Here's a closer look at the 5 new members. Kirk Milhoan, a pediatric cardiologist at Driscoll Children's Hospital in Texas. Milhoan holds a Ph.D. focused on myocardial inflammation mechanisms. He is a senior fellow at the Independent Medical Alliance, an organization established in 2020 that has campaigned against the use of mRNA COVID vaccines for pregnant women and children, while also advocating for unproven COVID treatments. His biography on the Alliance's website indicates a commitment to addressing vaccine-related cardiovascular toxicity due to the spike protein. At a 2024 panel on vaccine injuries, convened by Representative Marjorie Taylor Greene, Milhoan asserted that the risks associated with these vaccines outweigh their benefits. Hilary Blackburn, serving as a pharmacist and the Director of Medication Access and Affordability at Ascension, a Catholic health system. Blackburn is also the daughter-in-law of Republican Senator Marsha Blackburn from Tennessee. Evelyn Griffin, an obstetrician and gynecologist in Baton Rouge, Louisiana. Griffin is noted for being one of the first robotic-assisted gynecologic surgeons in the U.S. She has been active in efforts to reduce maternal morbidity and mortality. Local reports indicate that she has publicly opposed Louisiana's decision to include COVID vaccinations in the school immunization schedule and has testified about adverse vaccine reactions. A listen to Raymond Pollock, a transplant surgeon based in Illinois. Pollock gained attention in 1999 as a whistleblower in a lawsuit against the University of Illinois Hospital, alleging unnecessary liver transplant admissions. He has authored over 120 peer-reviewed articles and has been a principal investigator on various National Institutes of Health transplant biology grants and drug trials. However, his stance on vaccines remains unclear. Of Catherine Stein, an infectious disease epidemiologist at Case Western Reserve University School of Medicine, Stein has published 115 peer-reviewed articles, focusing her research on tuberculosis and infectious diseases. She has been openly critical of the U.S. response to COVID, suggesting that health officials have exaggerated death and hospitalization statistics related to the virus, As the ACIP meeting approaches, we will be closely monitoring the discussions involving these new members. Stay tuned for our updates. If you have any tips, suggestions, or story ideas, feel free to reach out to Annika at her new email, annika.constantino@versantmedia.com. Latest in healthcare technology, a mixed bag. Hello, this is Ashley, bringing you some bittersweet news this week. As of Monday, I have officially transitioned into a new role at CNBC as an AI reporter. I will be diving into the major AI labs, including OpenAI and Anthropic, for our site. There's certainly no shortage of stories to explore, and I'm eager to get started. However, this change means that this week marks my final contribution to the Healthy Returns newsletter. It has been a joy to connect with readers through this format, and I will miss writing it weekly. Fortunately, there is a significant overlap between AI and healthcare at the moment, so I will continue to cover the health sector from that perspective. You can still expect to see my byline in the newsletter occasionally. I'm not going far, so please keep in touch. You can send me tips and story ideas at ashley.caput@versantmedia.com. Until next time. Current trends in healthcare, inflation and GLP-1 medications. While grocery and gas prices often dominate headlines regarding the Consumer Price Index, CPI, healthcare inflation has been quietly taking a larger toll on our finances this year, and is expected to continue its upward trend into the next year, with medical care inflation reaching a 3-year high in August. Insurance companies are responding by increasing premiums across commercial plans. Although the CPI indicated that prescription drug prices rose by just under 1% in August, high-cost medications for cancer treatment remain the leading category for health expenditures among large employers. Notably, GLP-1 medications are becoming a significant cost factor, as the list of conditions treatable by Novo Nordisk's Ozempic expands, alongside rising demand for weight loss treatments like Zepbound and Wegovy. The challenges posed by high-cost, high-volume drugs are not new. Similar issues arose with the introduction of statins for high cholesterol in the 1990s and the breakthrough hepatitis C treatment Sovaldi a decade ago. In those instances, employers sought changes in pharmacy benefits management, PBM practices. This could be another pivotal moment for PBMs, as some employers are exploring ways to secure better pricing on GLP-1 medications through the cash market. While direct sales of GLP-1s would violate existing PBM contracts, new entrants in the PBM space are proposing innovative contract models for weight loss treatments and potentially expensive cell and gene therapies on the horizon. Patient CEO Brian Worley describes this situation as a stress test moment for the PBM market. Mr. Hemsley goes to Washington. United Health Group Inc. signage on the New York Stock Exchange on April 21, 2025. It has become increasingly common to see CEOs from major tech and pharmaceutical companies engaging with White House officials and even President Trump. United Health Group CEO Stephen Hemsley appears to be following this trend. Recently, he met with the president's chief of staff, Susie Wiles, as he seeks to navigate the company through a cloud of regulatory scrutiny. This summer, legal representatives approached the Department of Justice regarding an investigation into the company's operations, and an external audit of its Medicare and pharmacy benefits practices is expected to be released later this fall. In response to inquiries about the report, a spokesperson for United Health stated, "Public policy shapes healthcare across America, and it is our responsibility to engage with the administration and Congress at all levels to enhance patient access and affordability." If you have any tips, suggestions, or story ideas, please reach out to Bertha at her new email, bertha.coombs@versantmedia.com.